Two community health workers of Region 4 are calling on the government of the day to rectify a situation they are deeming as unfair. The women, Delisa Henry and Norina Watson, told Nightly News that they have been working diligently for the past 7 months but are yet to be paid a salary for this period. Now at their wits' end, the women, in expressing their frustration over the matter, are saying enough is enough. A distraught Watson told Nightly News that she and Henry commenced working on March 16, 2020. Henry is employed at the Enterprise Health Center on the east coast of Demerara and Watson at Suicide Health Center in the East Bank of Demerara. 9 months later, in December, they claimed they received their first salary, which was retroactive to March. According to them, that was the last time they were paid.
We've been working from January right up to this moment, and we haven't been paid not once. And every time we seek to find out about why we're not being paid, no one wants to release information as to why. All we get is frivolous excuse. We're waiting on this, we're waiting on that, we're waiting for this confirmation.
Watson, who is a single mother of one, said that it has been a rough year for her and her child since they are now forced to depend on other persons for financial assistance to survive.
I'm not being paid. I cannot send my son to attend lesson. I cannot leave him at a babysitter because I don't have the finance to pay for such. I have to be taking him to work with me. Sitting in an health center during a COVID season, that's one. And two, I've been eating daily out of my landlord's pot. Why? Because I'm not being paid to get any grocery in the house or so, and this has been happening since last year.
Watson said that while government continues to preach on the importance of healthcare workers as the COVID-19 pandemic rages on, they are struggling.
Are you trying to tell me that there's no one there that's of human tendency that can say, we're eating, we're wearing, we're living, we're providing for our children? Why can't they do it? We did not go and train because we wanted to smile and be in uniform. We did that because we wanted to provide for our family. We wanted betterment. That is why we went and do it the correct way. And I think it's only fair that we be paid.
Meanwhile, Henry, who is an expectant mother, said she was dependent on her salary to purchase items for her baby since her husband was recently suspended from his job.
I was expecting to be paid to finish off buying my baby stuff, and so I can't do that. I reached out to several persons and no one seemed to help. They're just telling you the RHO, he's telling us to go here, go there, go to labor, go to this. And every time you go, they're saying that they can't help.
According to Henry, the situation is unbelievable and unacceptable and needs to be fixed with urgency. Regional Health Officer of Region 4, Dr. Gavin Nash Prasad, when contacted for comment, conveyed that the approval for the payments to the women is currently pending. When questioned further regarding the cause of the delay, Dr. Prasad would only mutter, "I can't say." According to the two very upset health workers, this is the exact nonchalant response they have been getting from the Regional Health Officer for the last 8 months. Meanwhile, Vice President of the Guyana Public Service Union, Don Gardiner, divulged that the matter is engaged in the attention of the union. "It is an unfortunate situation. How can workers be working and not being paid? Cost of living has increased," Gardiner lamented. The woman then made a staunch call on the government to pay the workers without delay. Reporting for the HDP Nightly News, Kendell Richmond.